I'm Molly with PatientIQ. I'm sitting here with Dr. Huddleston, and today we're going to be talking about patient-reported outcomes and the American Joint Replacement Registry. Dr. Huddleston, would you like to introduce yourself?
Thanks, Molly. It's a pleasure to be here today with you. I am a orthopedic surgeon who specializes in hip and knee replacement at Stanford University. I also serve as the chair for the steering committee for the American Joint Replacement Registry.
Great. Thank you for joining us today. All right, what are your long-term goals for PRO integration and registry participation? Big picture vision.
Yeah. So, I think our need to demonstrate quality is of the utmost importance. And with the discussion of quality, obviously comes the cost discussion. They go together. We have an obligation to demonstrate, how good our business is, and patient-reported outcomes are the way now to do that. We face a real uphill battle in terms of facilitating collection and usage of these. I think, as you all know, we're making progress on it, but we're not there yet. So the fact that it's mandated by CMS is getting everybody's attention. So in AJRR now, we have about 4.5 million procedures in the registry as of last week. 47% of all of the roughly 1,500 institutions in the registry have submitted. 1,500 institutions have submitted any patient-reported outcome, and we have seen since the PROMS mandate was introduced, roughly 27% increase in the number of PROMS being submitted. So that's moving in the right direction. But anything that we can do to foster this effort and make it cost-effective and get the surgeons to use it will expedite that. But in terms of linked PROMs overall in AJR, we're still at about 25%.
What are the benefits to your practice from using the Joint Replacement Registry?
Sure. So I think there are many. I wish we used it as a group more than we do, and I think that's common for many practices around the country. So, we have very user-friendly dashboards at this point, and you can see how you compare to national benchmarks, which I think is part of the value. So in terms of driving quality improvement, that's one of the main value propositions for the registry. Participation in the registry gets you potential benefits with payers. So there's an initiative with Blue Cross Blue Shield of America that to become a Blue Distinction Center, you need to have AJR data that the academy can share with the insurance company on an institution level. So that's an example of one of them. There are several others. One of the things we just went through at Stanford is obtaining advanced certification for hip and knee replacement through the Joint Commission. And one of the requirements for that is that you submit data to AJRR. So, and then we already talked about sort of what the direct patient benefits were. So I think there are lots of benefits, but driving quality improvement is probably the underlying message behind all of them.
Great. And could you explain a little bit more why a site might be interested in becoming a Blue Distinction Center of Excellence or having a Joint Commission certification?
Yeah, so the goal is to say this is our stamp of quality, and that should drive people to come and see you. That's the main goal. But it is a stamp of quality. To get the advanced certification at Stanford was, for us, a 2-year project. It involved over 80 different team members from folks who touch the patient across the entire continuum of care. So it was a complete revamp and to some extent an affirmation of things we were already doing. But it really helps to streamline the process and to make sure that you're implementing best practices and holding people accountable when the ball gets dropped, which in a complex tertiary care environment inevitably happens some of the time.
So I want to talk a little bit about the challenges you might have encountered with data collection and reporting and how you found EHR integration into your workflow to be helpful.
Sure, yeah, so there's no question that collecting and hopefully using patient-reported outcomes is a very heavy lift. It's such a heavy lift that we've began referring to it as the unfunded CMS mandate, which folks obviously aren't too happy about. So, I started at Stanford in 2005, and one of the efforts that I was involved in early on was the California Joint Replacement Registry. We were one of the founding members, and I wasn't very successful in trying to get our administration to understand that patient-reported outcomes really shouldn't be viewed as a research tool, but should be viewed as a quality improvement tool. So fast forward now 15 years, and all of a sudden we're being told that we have to do this or you're going to get fined. So, you know, in the early years of my practice, trying to operationalize collection and usage of patient-reported outcomes was a very frustrating endeavor, and was, quite frankly, not successful. At sort of a baseline, not giving it too much attention, doing the best we can, you know, giving the patients different ways to do it, whether it's at a kiosk in the waiting room of your office, or giving them a tablet, or sending them an email with a link or a text message. If you do all of those, at least in our practice, and you don't really do anything else to beat the drum, so to speak, the best we would ever do was about 50%. So that's not where we need to be. It's, you know, better than some places, but certainly not where we can get sort of real actionable data and use the patient-reported outcomes on any meaningful basis. So, you know, in short, I would say integrating the workflow with the EHR has been very difficult. I think since PatientIQ has come along and other vendors in that space, you really have made a big difference in making it easier and making the business case for making it easier. But I think perhaps the most important thing at the end of the day is that if the surgeon, as the champion, is not involved in the process, both from a cultural standpoint at the institution and also from having the patients see that you actually are using the data that they've taken their valuable time to supply for you in the PRO. If you're not showing folks that you're using it and you're going to change the culture, you're not going to be very successful.
What metrics are the most important to you when evaluating the success of your PRO program?
Yeah, so I think that the magic number is what's the rate of linked proms, right? So a preoperative prom, and then as CMS has set forth in the CMS IQR patient-reported outcome performance measure, it's what is your percentage of one-year linked proms that you're getting, and they've set the benchmark arbitrarily at 50%. I think it's important for folks to realize that it's going to be hard for you to ever get one-year linked proms if you don't have a very high number of preoperative proms. So that's really, in terms of any technology that can help us, being able to demonstrate that we can, on a regular basis, collect linked proms is really, I would say, the height of the value proposition.
How do you envision the registry contributing to the shift from a fee-for-service model to a value-based care model?
Yeah, so the registry is already doing that in a number of ways. So I don't know how much you know about the CMS Quality Payment Program, but the registry facilitates reporting, and even establishing measures in MIPS and in MIPS MVP pathways. And then also they facilitate the registry facilitates patient-reported outcome measure collection and reporting directly to CMS for the alternative payment models and for the new alternative payment model teams, which is starting on January 1st, 2026. The registry, which also facilitates the PROMS mandate reporting now, is going to do the same thing for teams. So they have an active role in the measurement process and submitting those data, which is, you know, the best that we have for value-based care. Now, the next best thing we think for value-based care is to move from a procedure-based bundle to more of a disease or osteoarthritis-based bundle. And in that endeavor, AJRR's role for facilitating PRO collection will be even